Hello, welcome to my video. I'm Dr. Micah Mendelara. This is a series of brief videos, each one's about 2 to 3 minutes long, on how to eliminate chronic physical and chronic emotional pain. For today's video, let's talk again about chronic physical pain, and in the next video we'll get back to some more of the topics on chronic emotional pain. But focused on chronic physical pain, what types of chronic physical pain respond to the Zero Pain Now mind-body mindfulness approach that I use? And I already mentioned in the previous video that it's non-organic functional pain that responds. In other words, physical pain that starts with emotions, stress, tension, and buried or repressed emotions, and that leads to physical changes in the brain, which lead to physical changes in the body, which lead to pain. So that's the type of pain we can eliminate quickly and easily. And in this video, I'm just going to go over some of the specifics so you'll know if the type of pain syndrome you have is one that most likely can be eliminated quickly and easily. And keep in mind that when I say chronic pain, I refer to 6 weeks or longer. Because if you've had pain for less than 6 weeks, it's very possible that you just injured yourself or have an infection or something that regular traditional medical or just regular first aid or whatever can treat and can solve. And unless your pain's gone beyond 6 weeks, we don't know if it's just an acute pain or if it's going to end up being chronic. But if you've had pain that's been 6 weeks or longer, possibly even years or decades, then these are the types of diagnoses and pain syndromes that almost always are really starting with stress, tension, and emotions. Low back pain for sure, or any type of back pain, or neck pain for that matter, no matter how long you've had it. And this is really important, even if you've been diagnosed with structural abnormalities that your healthcare providers say have been causing your physical pain, because it's a big myth and misconception, even amongst doctors and medical professionals, that structural abnormalities, especially age-related degenerative changes like herniated discs or bulging discs or spinal stenosis or even torn meniscus in the knee or shoulder tears, rotator cuff tears. It's a big misconception amongst healthcare providers that these types of structural abnormalities usually cause chronic pain, because most of the time they don't. The real cause is emotional. It's stress, tension, and buried emotions. So let me go through the list of things. If you have any of these things or anything that sounds very closely related to this type of pain syndrome, then it's very likely that you can eliminate your pain completely and permanently. Like I was saying, back pain, even if you've been diagnosed with herniated discs or bulging discs or osteoarthritis of the spine or spinal stenosis, same thing is true for low back pain or upper back pain or chronic neck pain. Speaking of chronic neck pain, chronic whiplash. Acute whiplash, very common. Pain from whiplash that lasts more than 6 weeks almost entirely is caused by emotions and not the initial injury. So chronic whiplash, almost always the pain can be eliminated if you know how. Other types of pain syndromes that are almost always eliminated with a mind-body approach. Chronic tendinitis, fibromyalgia. When I say chronic tendinitis, it could be rotator cuff tendinitis, it could be Achilles tendinitis, it could be tennis elbow or golfer's elbow, could be something that's kind of related to a tendinitis, plantar fasciitis, or you may know this by heel spur diagnosis. Also TMJ, the jaw joint in this area right below your ear. A lot of people have chronic problems with that, usually related to stress, tension, and emotions, and easy to eliminate. Other ones, I forget if I already mentioned fibromyalgia, but fibromyalgia is always caused by stress, tension, and emotions, even if your healthcare provider has not learned that yet. Chronic headaches, especially migraine headaches and tension headaches, these always respond to a mind-body program that eliminates stress, tension, and buried emotions. There's many others. Carpal tunnel syndrome, most forms of chronic neuropathy, especially if it's not related to something like cancer or chemotherapy or something like that. Let me think. I'm trying to think. I know there's others that I'm forgetting. Well, there's a lot of pain equivalents that are caused by stress, tension, and emotions, like irritable bowel syndrome. I guess you could say that's painful because you get stomach cramps. Adult rashes like chronic acne or chronic eczema in adults. And getting back to the pain syndromes, I'm quickly just thinking if there's anything I'm forgetting. I guess that's the main ones. I have a more extensive list because I'm sure there's ones that are just not popping in my head right now. So these are the general types of pain and disorders that most of the time will respond to a mind-body program like Zero Pain Now. And if you have been diagnosed with any of these syndromes, it's extremely likely that you'll be able to eliminate your pain once and for all permanently.